So welcome in, everybody. My name is Sarah from the Definitive Healthcare team. Thank you so much for joining us today for our webinar, Leveraging Commercial Claims to Find Your Ideal Patient Population. I'm excited to be hosting today's session with Evan Cox and Mary Kate Grow. Evan Cox is the Associate Vice President of Product Management at Definitive Healthcare. With over 15 years of experience in planning, developing, and delivering software solutions, Evan was closely involved in the development of Latitude Reporting. He has previously held positions at WebMD, Press Ganey Associates, and Change Healthcare. Mary Kate Grow is a product manager at Definitive Healthcare. With 4 years of experience in healthcare data analysis and product management, she worked directly on the development of Latitude Reporting. Welcome, Evan and Mary Kate.
Thank you, Sarah. Great to be here.
Thanks, Sarah.
With that, I'd like to hand off directly to you, Evan.
Wonderful. Well, thanks. Today we're going to go through a few things. Obviously, we've started with our speaker introductions. We'll move into some industry challenges, sort of the therapy development lifecycle, and talk a little bit about the product that we've built, which is really going to help you in that process. And we'll do a live demo here. We're not going to spend much time in slides at all. And then, time permitting, as Sarah mentioned at the end, if we have some questions, we'll be happy to answer those. All right, so why are we all here? Well, the path to commercialization is complex and expensive, and that's not a secret to anybody on this call. Mary Kate and I have run through the attendee list, and it looks like there's a lot of folks from biopharma and from the medical device side of the house. These are problems that'll be very familiar to all of you, whether you're at the point in your process of just beginning market sizing and understanding what the opportunity for a new drug or device is, or you're securing funding, or you're taking a look at your competition, or even at the point of figuring out sales territories and strategies. This is certainly a product that can help with a lot of those problems and really ease your day-to-day. So, Latitude Reporting, that's the product we're going to be covering today. Fundamentally, it allows you to report on complex patient cohorts. So we roll together diagnoses, procedures, and prescriptions using ands and ors to get you exactly that right population of interest so that you can go and do the robust reporting you need to understand everything you need to understand about those populations. As I mentioned, we're not going to spend much time in slides. So at this point, I will hand over to you, Mary Kate, and we can dig right into the product.
Thanks, Evan. Yeah, we will jump over to the product here. And as Evan mentioned, everything in Latitude Reporting is really centered around that cohort of patients that you care about. And that cohort is created by using a combination of diagnoses, procedures, and prescriptions that are interesting to you. So today, we're going to dig into patients who have back pain and take a look at how those patients are being treated today. So to do that, we'll start with a population of back pain patients. So I will start here by adding a diagnosis to define that population, create a new diagnosis, back pain. And here I'm going to get 4 codes returned. These are all codes that meet my criteria of the keyword search that I just input there. I will call out for our medical coding experts on the phone today. We also do have the ability where you can just paste in a list of codes. So often we know you have those saved offline, and we want to make sure that's a really smooth experience for you as well. So don't fear, keywords are just not the only route here.
So as Mary Kate names and saves this population, I think she touched upon something there very important. And I'll highlight it every time we come across one of these instances in the product, but a lot of our workflows are designed to have a very easy path for folks who aren't those clinical coding experts or who aren't medical claims experts, and then a path that's much more flexible and robust. So if you don't know the codes, go ahead and do a keyword search, and we'll logically group the codes together for you and do everything in our power to make it easy for you to identify the right codes and select them. But if you're like some of our users who have a list of codes in an Excel sheet sitting on their desktop at all times, you can certainly just paste those in as well and have easy access to your population. Even if you're pasting in, we have your back. We'll validate those codes and throw an error letting you know, hey, this particular code isn't valid should you have dropped a leading zero or fat fingered a code along the way.
Exactly. And throughout the whole process, we want to make sure you're informed. So that's why as soon as I put in that low back pain diagnosis, we pulled those unique patient counts. So now we can see we're looking at 9.2 million patients in the last 12 months with that diagnosis. And this is really intended to guide you and make sure you have the right codes, right? If we saw 100,000 patients here, we'd probably know that we were missing something. Now that we have this first diagnosis in, we can continue to add additional diagnoses, procedures, and prescriptions. So I'm going to say I want patients that had low back pain or had a diagnosis for sciatica. So here we have cast a broad net of patients who have back pain. But of course, I could always use an and here instead of an or continue adding criteria to really hone in on specific patients if that was what I was looking to do. So lots of options here when you're creating your cohort to make sure you're getting exactly what you need. And that also includes a few additional filters on the side. So here you want to hone in on a specific patient age or gender, or take a closer look at a specific type of provider. You can certainly do that as well. But now that we have captured about 10.6 million patients here and the 750,000 providers that are treating them, I'm going to save this cohort and we're going to bring that into our analyze step. So as soon as I save this cohort, we are going to do two things for you. So the first is we are going to make that patient population available for you next time you come, as well as for your coworkers. So that way, when you come back tomorrow and need a new report, you don't have to put in the codes again. You can have a really consistent reporting experience and really speedy as well, because that part of the process is already done. The second thing we're doing, and what you just saw generate in real time, is we're going to kick off a high level look at the patients and providers in your cohort. So this page here, we call this Analyze, and this is really meant to do two things for you. So first, it's meant to give you a gut check that the codes you threw in the last step are producing the right results. So here you can take a look, for example, at the specialties of the providers that are treating these patients. And here we can see a lot of family medicine, emergency medicine, some chiropractors and physical therapists. These are going to be the types of providers I would expect to see with a pain cohort, so that's a good sign. I can also take a closer look, for example, at the patient age and gender. So here we're seeing this population skew a little more female and really target slightly older adults. So that is again going to be a good sign that the population we created is correct. And now we can have the confidence moving forward and sharing this data with coworkers, bosses, whoever it may be, knowing that we have the right population. So that's the first thing, a gut check that your population is actually correct. The second thing, and my personal favorite, is that we hope that this page gives you a little bit of an opportunity to learn more about your patient population. So today, if you get an offline feed or a data cut, you have to know the questions you want the answers to when you request that report. And you don't have a ton of opportunity to iterate and explore the data. So I hope that this gives you a chance to poke around a little bit and just learn more about that patient population. So for example, here we can see that among our pain patients, we're seeing 13% of them are being diagnosed with radiculopathy. Or we can see about 13% have a type 2 diabetes diagnosis. So it's just going to give you a little more information so that you can learn more about the population before you dig into the details in reporting.
And tied to that theme earlier of here are some things for our more novice users and here are things for folks who are a bit more sophisticated. I think this is a great example of that. So if you're just really looking to validate the population I've created is the population I expected, this is a great spot for that. And as Mary Kate pointed out, there's a handful of places where you can sort of dig in a little bit and get a clear understanding that you have in fact created that right population before you move along and start doing reporting on these data assets. But if you're a slightly more sophisticated user or looking to do some of that investigation, like Mary Kate mentioned, this is a great spot for you to be able to lean in and say, that's interesting. 13% had lumbar region radiculopathy. Maybe that should explicitly be in my cohort, or maybe these aren't patients that I'm looking for, or maybe that's a newer emerging condition that your drug or your device may be uniquely positioned to support and provide value in. So really another opportunity here for you, depending on the user type you are, to dig in for a couple or a few different reasons and learn more about the data. Remember that to get here, all we've actually done is Mary Kate typed in the word back pain, saved something, and here we are to these insights. So incredibly quick and very, very straightforward.
Yeah, and to that point, if this is the data you're looking for, you can pull this right down into an Excel spreadsheet. We can pull this data tile as an image, and you can throw it into a slide deck or a data sheet and be right on your way. Or if you're looking for more in-depth analysis, reporting is definitely gonna be pretty exciting for you, and we can head over there right now and generate a report on this very population. So the reporting workflow here is really just a few steps, and we've done this with the goal of making it as quick and easy as possible for you to get the data you need. So our first step here is choosing the report type you would like to make. Each of these report types is pretty akin to an aggregation of the data. So a provider essentials report, every row in that report is going to be the providers that are treating the specific patients you care about. But we can also look at that by patient age and gender, so get a demographic breakdown, take a look at where those patients are located, a cohort-specific payer mix, or even take a look at that other care those patients are receiving, those diagnoses, procedures, and prescriptions.
And this is another one of those spots where there's a happy, easy path and a more robust path for other types of users. All of these reports, as Mary Kate mentioned, are just templates. So we think this is probably the right information to get you started if you're looking at providers, or some good columns for you to pull together if you want to understand more about the payers paying for the patients in that cohort that you've created. But these reports are all also very flexible. They are just templates. So if you wanted to pull out just about every column from any one of these reports and start on your own, you're certainly welcome to. And Mary Kate will show in just a couple of steps all of the columns that you can pull in to make these truly customized and bespoke reports exactly for your use case.
Yeah, let's jump into a provider essentials report here. Next up, choosing the time frame you're interested in. So we do have month level granularity here. So if you want a single month of data, we can certainly accommodate, or if you're looking for 24 months, you can run a big report like that. Next up, we have our refinement step. So this is where you can optionally limit your population or your report by either patient or provider location. So this is really to cut down the noise in the report if you're looking to, if you're just interested in a specific area.
Yeah, I would say think sales territory creation in here, think market sizing. This is your ability to say, these are the states I define as New England. This is what I define as the Pacific Northwest, and be able to report on just those regions that you're interested in to, as Mary Kate pointed out, really hone in on exactly what it is you're trying to get to.
Awesome. So we'll run a national report today. And the last step here, and this is where things get a little more exciting, is choosing the columns that you want to include in your report. So each of these columns kind of fits into one of two buckets. So the first is foundational data on the physician that's going to make your commercial claims insights actionable. So think here things like the provider's name, specialty, location, and affiliation. This is all of the data that Definitive, kind of our bread and butter here, and makes everything that the commercial claims tells us something that you can act on. The second type of columns we have here are going to be custom diagnoses, procedures, and prescriptions that are specific to the things that you or your coworkers have created. And these can be added into the report as columns to give you even more insight into how these providers are treating these patients today. So here I've added in steroid injections, spinal cord stimulation, opioids, ibuprofen, a whole bunch of treatments for back pain. And now when I click generate, this report is going to give me not only information on who the providers are that are treating the patients I care about, where they're located, how they're affiliated, but also how they're treating those patients today. So these will give you both the number of patients and the number of claims for each of these treatments. So you have a really full picture of the market today.
So I think this is probably the most powerful portion of the product as a whole. I think the cohort creation is obviously key and remarkable. But what this really allows you to do is create a slightly more generalized population that you're interested in. So we created a back pain and sciatica population. We did not create a back pain who has had a steroid injection population. We did not create a back pain who has had a spinal cord stimulation population. These really allow you to create exactly the output you're looking for to understand some of the treatments around those patients. So, think your product, right? That steroid injection could be your injection. That spinal cord stimulator could be your spinal cord stimulator. Think your competitors' products, right? You may want to create a report that is your solution to this problem, as well as your competitors' solution to this problem, so you can understand at a physician level which physicians are prescribing or implanting your device versus your competitor's device, how prevalent in what regions. Really, really powerful section of the product that I just don't think we can highlight strongly enough.
Yeah, and it's also worth noting here, pull in other diagnoses, pull in complications, pull in comorbidities, and get a really, really great idea of how those patients are being treated today. So at the risk of going on too long about these things, I will move on to saving this report. It will complete that report, and just like that, it's going to start generating. So these reports typically generate in between 1 minute to, if it's a really big population, maybe 10 minutes. And as soon as it's ready, it'll be available to download as a CSV for you to use in an offline analysis, or come take a look at it, come back, iterate, create another version, and generate another report. While that is running, I can pop open. This is a very similar report I made just before this call. And we can see from this sample data that we're going to see the top providers in this space. So we see Dr. Ledbetter here in Louisiana, and we can see how many patients in the cohort he's treating and which treatments he's reaching towards. So here we can see that Dr. Ledbetter is doing quite a few steroid injections, but he's also familiar with spinal cord stimulation, right? And sometimes he's writing scripts for painkillers. So now you have a pretty full picture of how this doctor is treating patients, and you can make informed decisions about how you can reach out to this market and have informed conversations with the provider themselves about how to help him care better for his patients.
These reports run quickly enough, and I suspect you'll find out by the time that Mary Kate and I, hey, look at that. By the time we're done talking about the report will have actually run itself. So when we have reports that run this quickly, not only is it hugely convenient and helpful, a lot of your decision-making doesn't have to happen this week. It has to happen today. Rest assured your competitors are going to be trying to make the decision today rather than sometime this week. And there's actually a couple of huge benefits to that. One is obviously time to insights is very, very short. But the other is, since these reports run so quickly, you can create a report and just really be out on a flyer, right? is this a valid thing or not? Let me try something. Let me, sort of step outside of these four walls, if you will, and run a report that's a little bit more speculative. These are the kinds of things you generally don't do if you have to compose an email and ask a question to a group within an organization, be it our professional services group or someone else's, to try and pull that information out, right? You're going to ask questions that you know are going to bear fruit. This happens quickly enough that you really can experiment and try and learn along the way. So run a report, take a look at those results and say, you know what, let me go back and change that cohort a little bit. Let me add these codes. Let me take a look at patients who have only been on drug treatments rather than implantable or surgical treatments, which just helps you iterate, grow, and learn more and more over time more quickly.
Yeah, that's exactly right. And, it took us 20 minutes today to generate this report, and we were talking through the whole thing. So I hope that you all can see why we here at Definitive are so excited to bring this new product to market. And it's really changing the game in how we do commercial claims reporting, and what we'll have the opportunities to do moving forward. So we're really very excited about this product here.
As you can probably tell.
Yeah. I will switch back to the slides now as we wrap up before we have a few minutes for questions.
So to wrap, right, what we just showed you is our new Latitude reporting solution. This, we hope, allows you to have access to data that might have previously had to come from someone else in your organization, that you might have sent an email and said, hey, can you send me something that looks like, hey, I'm looking for a population which, right? Now we're putting that power of those users into your hands and in a very easy to use, interactive, like real-time interface. The reports you create and those populations you generate, it all happens while you're in the product. It's effectively real time. So there is no more waiting for days or for weeks. There's no more sending off an email and asking, hey, can you create a population for me that, and then here are the fields that I want to see as an output, only to realize that a field has been missed or something wasn't exactly as you expected. Real-time insights out of here. And bringing not just the commercial claims assets, but all of the rest of the great things that we do here at Definitive, putting those claims in context, right? Who are these physicians? Where are they affiliated? How do I reach them? How many patients? Really being able to bring that commercial claims asset to a much more holistic view of the healthcare landscape to help you better understand the opportunities that you may have. And hey, look, Sarah's back.
Yes, we have been getting quite a few questions from the audience. So let me just start with, okay, is there a limit to how many rows I can download?
That's a great question. So no, in the exports themselves, we're not going to be limiting to how many rows you can download, because we know you need all the data for the analysis you're doing. So good news, no limits on those exports there.
Great. All right, next question. I'm wondering if this is institutional and professional data.
It is. So this is both professional and institutional claims that are queried when you're creating that cohort and when you're reporting, really giving you that full picture of a patient's care.
Great. Okay, this is probably the most common question here. A form of, I'm already a DHC customer. Where do we find this capability? Is this a separate module from the claims data menu?
So separate module, yes. Obviously, you'll need to have our commercial claims assets in order to get to have a product like this. But you should reach out to whoever your Definitive contact is, be it your customer services manager or your account engineer. Or your account manager. They'll be happy to help you either find it if it's something you're already contracted for, or spend some time with you to give you a one-on-one demo and figure out how you can get your hands on it.
Awesome. All right, another question is there a cost for how many queries I can run?
That's a good one. You get it a lot, Mary Kate.
No, there's not. We are really our goal when creating this product was to allow you to have your hands on this claims data. So in order to do that best, we thought don't limit users as to how many queries or reports or cohorts they can make, but you have all access to that data when you get access to Latitude Reporting.
So please go in and play, make some things, learn some things, and continue to engage with the data.
Yeah. Great. All right, we have time for a few more. Let's see, are the diagnosis codes pulled from primary only, or are all diagnoses found on the claim included?
Yeah, that's a great question. So we are looking at all diagnoses on that claim, so not just the primary diagnosis at this time.
At this time. Hint, hint.
Okay, I think maybe a more generalized question about where does the search begin? So are you starting with create cohort?
I can take that one. Yeah. Yes or no is it's kind of the answer. So your first time you use Latitude Reporting, you'll start with creating a cohort. But when you come back the next day or week or month, you'll already have a cohort created. So you can jump right into analyzing that cohort or right into reporting on it. So we sometimes do talk about Latitude Reporting as a 3-step workflow: create a cohort, analyze it, report on it. But the second, third, fourth, 100th time that you enter into the product, you can skip step 1 and go right to getting out the data that you need.
Awesome. All right. Is there data to contact the HCPs that have been identified?
Email address, all in here. Yes, absolutely. So if you've created your perfect lead list by creating that cohort, finding the doctors in a particular region or territory, you absolutely can export this data with the contact information so that you can actually start acting on the insights you've created.
Great. All right. Next question is, what if the treatment that I'm looking for isn't listed? Is there a way that I can search for that?
Yeah, so anything that is definable by a ICD-10 diagnosis or procedure code, a CPD HCPCS code, or an NDC code can be used to define a treatment or diagnosis. So you can certainly go in and create as many of those as you want. Maybe you have, you have 10 treatments and your competitor has 10 treatments. You can go in and create all of those and then report on them to your heart's desire. So yes, you can add in as many things as you'd like there.
Awesome. Okay, and then I think last question here, just looking at time. Is there a way that you can set age limits on the claim, such as searching for a specific age group?
Yeah, absolutely. So when you're building that cohort, you can refine by your patient population by a specific age group. And then you can also, on the reporting side, you can also report using that patient demographics report and see a little more broadly how different age groups are being treated. So that's kind of one of my favorite things to look at is, how does treatment vary by age or gender groups to, look at the claims data that you may not have done before.
All right. And with that brings us to the end of the webinar. We're right at time. So I just wanted to thank you, Evan and Mary Kate, for being with us today. And thank you everyone who joined in. And thank you so much for joining us.
Thanks, everyone.
Thank you.